Hi everyone, my name is Dr. Sayer and I'm responsible for the awakenings of encephalitis lethargica patients. Today I'll be performing a self-interview to hopefully shed some light on the situation and explain a little bit about what went on during the drug trial. When I began my research, I just refused to believe that there was no connection between any of these patients that all seemed to be suffering from the same illness. I went through every single case file and I eventually found that they all suffered from encephalitis lethargica. This is a disorder characterized by high fever, double vision, and delayed response. While we don't know the exact cause of encephalitis lethargica, it has been linked to influenza and other viruses and bacteria. Parkinson's is a progressive nervous system disorder. Tremors are very common in Parkinson's. It also causes slowness and stiffness in movement. People experience speaking and writing difficulties. These symptoms are very similar to encephalitis lethargica. In both disorders, people experience a loss of movement, shaky, rigid motions. However, one thing that is different between Parkinson's and encephalitis is that Parkinson's is more common in men, while encephalitis seems to have no particular preference between gender. Parkinson's is also far less debilitating than encephalitis, as Parkinson's can be treated in most cases. Levodopa is the drug that was used to treat Leonard and the other encephalitis lethargica patients. It is commonly used to treat people with Parkinson's and it is used to manage their symptoms. Levodopa can affect neurotransmission by crossing the blood-brain barrier. In people with Parkinson's, there's a degeneration of the substantia nigra. This provides disruption of the nigrostriatal pathway, which decreases dopamine levels. Levodopa converts to dopamine and therefore regulates dopamine levels. So to increase the availability of levodopa and decrease the symptoms of it, side effects of it, it is administered with a decarboxylase inhibitor, which allows for more levodopa to cross the blood-brain barrier. Encephalitis lethargica affects the neurotransmitter dopamine. A lack of dopamine can cause Parkinson's disease. L-DOPA increases the presence of dopamine, as I mentioned earlier, and this regulates the levels of the neurotransmitter. Before the drug, the patients were catatonic. This means that they weren't really responding to much. They were kind of just sitting there. They had little to no control over their movements and bodily functions. It was as if these people were trapped inside themselves, asleep within their own bodies. They were mere husks of their former selves. After the drug, they regained physical movement and they began speaking and functioning. They returned to a happier, more conscious state. These behaviors were caused by L-DOPA regulating the levels of dopamine. Without regulating the dopamine, the brain has no motor control, motivation, or reward. The patients just really had no purpose in life before the levodopa. So as treatment continued, patients became hypersensitive to levodopa. This caused them to have severe side effects with their treatments, even with small quantities of levodopa in their system. The drug quickly regressed from a blessing to a nightmare. As the side effects took over, the patients deteriorated to their original state. They felt their consciousness slip away and they became catatonic once more. As far as the nature versus nurture argument goes, there's not really much that could be linked to nature for encephalitis lethargica, just simply because we don't really know what causes it. So therefore, I really believe that it is more nurture related, because treatments and side effects and symptoms all depend on their environment, how the hospital is handling their case, how their families have decided to treat them. It really just depends on the people around them and their situation, their hospital that they're in. doesn't really have that much to do with their genes as far as we can tell, because we really don't know the cause of encephalitis. Now, this is the question that I have the most notes for, just because I simply don't want to accidentally misstate something, because it's a very controversial topic. So there's quite the ethics battle surrounding this case. I only have a few minutes to address this issue, so we're not going to get too deep into it, but I will go into further detail in a further video. So in an attempt to explain both sides of the argument, I will explain two opposing sides, obviously. On one hand, many people believe that the drug trial is unethical because of how quickly it was conducted. I'll admit I was awfully excited to see Leonard's progress, and I may have jumped the gun a bit when I started administering the drug to the other patients. I should have waited a few more months until we knew that L-DOPA was going to be successful and pleasant for everybody involved. Another issue was that many people thought that I should have gotten consent from the patients to administer the drug to them. In their current state, the encephalitis lethargic patients were in no like state of mind to give me consent to administer the drug. Of course, this responsibility was bestowed upon their family members that were overseeing their care in the hospital. Now, on the other side of that argument, many people would argue that the trial was ethical because I did ask for consent from the family members of the patients. I didn't intend to harm anybody, and they didn't go through much physical pain, mostly just some slight discomfort from the withdrawals of the drug. However, I'm beginning to feel like a monster. How cruel of me to give somebody life and then just watch it be stripped away again. It was as if they were getting sick all over, slowly losing their newfound purpose. For that, I will never forgive myself. In this way, I believe that my actions were truly diabolical. Many patients were shocked and disturbed after their awakening. They found themselves alone with nobody to comfort them, their spouses and children gone, leaving them alone in the hospital. They only really had their caretakers around, and they knew little to nothing about them. It really just... I didn't expect them to be so disturbed when waking up, and I would have never tried to awaken them if I knew that they would eventually just revert back to their old state. Now, I also don't believe that I violated any APA guidelines. Yes, I did have a deeper connection with Leonard than most people would have with a patient of theirs, but that was simply because I felt responsible for my patients. I wanted them to succeed in life. I wanted nothing more than for them to rejoin society and be able to make up for all the years that they had been missing. My relationship with Leonard was the closest out of all of the other patients, and he had consented to letting me observe him and learn from him so that we may eventually discover like a proper cure for encephalitis. They always say that hindsight is 20/20, but I didn't really believe that until I came on this case. So I think that this drug trial was very cruel, and I'm so sorry to all of the patients and families that I've hurt. I feel as though I've left everyone down. If I were able to do anything differently, I would have waited to administer the levodopa to all the other patients. I wish I could have seen the long-term effects, but I'm afraid I jumped the gun a little bit when it came to waiting for the trial to reach like even just a few more months just to see what the side effects would be. If I'd known that I would hurt Leonard or any of the other patients, or if I'd known that the treatment would only work temporarily, I would have never administered all of the drug to all of the patients. I would have warned their families. I would have asked them if they truly wanted these patients to be awakened. In their awakenings, I created a monster within myself. I fear I will never be able to outrun the pain that I have brought to these people. And that is something that truly saddens me, because I feel like I'm just a monster for giving them life and taking it away. And on that note, this is the end of my interview. This has been Dr. Sayer. I am so sorry to everybody that I have involved in this drug trial, everybody that had their hopes up. It has been quite the monumental failure.